Chapter 6. The Human Body. Introduction. As an emergency medical technician, having a clear understanding of human anatomy, physiology, and pathophysiology is essential. Anatomy is a field of study that focuses on the physical structure of the body and its systems. Physiology goes a step further, examining the normal functions and activities of these biologic components. Pathophysiology is the study of functional changes that accompany a particular disease or syndrome. This chapter provides basic information about the many structures and functions of the body and its parts. Topographic anatomy. Many anatomic landmarks on the surface of the body are easy to identify. It is not too difficult to find the umbilicus, navel, or the lower tip of the breastbone. In much the same way that X marks the spot on a map where something hidden can be found, these surface structures, the body's topographic anatomy, help guide the emergency medical technician to the locations of internal features that lie beneath. Understanding these external to internal relationships is fundamental to an effective patient assessment. Directional terminology ensures consistency and clarity of communication between providers. Imagine being on scene with a trauma patient and calling the emergency department to report your findings. When the nurse answers the phone, you need to relay the specific location of your patient's injury as clearly and concisely as possible. And the nurse, in turn, must be able to quickly and accurately interpret your description, virtually seeing what you see. How will you accomplish this task? Begin by imagining the patient standing in the anatomic position, with palms and feet facing toward you. This position is a frame of reference used by all healthcare providers. In addition, directional terms are always presented from the patient's perspective, for example, the patient's right leg, as opposed to the emergency medical technician's point of view. To illustrate, imagine you are face to face with a patient complaining of pain in his left arm. From your point of view, the affected arm is on the right, but from the patient's point of view, the arm is on the left. Both perspectives are accurate, but when reporting the information to another healthcare provider, you would refer to the affected limb as the patient's left arm. The planes of the body. Another approach used when describing a particular location on the patient's body is to divide the body into anatomic planes. These imaginary straight-line divisions begin with three main axes. The coronal, frontal, plane runs vertically through the body, and divides it into front and back sections. The sagittal, lateral, plane also runs vertically, but divides the body into left and right sections. It is worth noting that these left and right sections do not necessarily need to be divided equally. However, a subtype of the sagittal plane, the mid-sagittal, midline, plane, divides the body into equal left and right halves. Your nose and umbilicus are found along this midline. Last, the transverse, axial, plane divides the body horizontally into top and bottom sections. These planes help you to identify the location of internal structures, and understand the relationships between and among the organs. From cells to systems. Cells are the foundation of the human body. Billions of cells compose the human body. Every organ, every body part, and every structure can be reduced to individual cells. Cells that share a common function grow close to each other, forming tissues. Groups of tissues that perform similar or interrelated jobs form organs. Organs with similar functions work together to comprise the different body systems discussed in this chapter. The skeletal system. Anatomy. The skeletal system serves many functions, but some of the most obvious are 2. 1. Provide structural support to bear the body's weight. 2. Establish a framework to attach soft tissues and internal organs, and 3. Protect vital organs such as the heart and lungs. In addition, the red marrow found within the internal cavities of many bones produces red blood cells. Bones. The 206 bones that compose the skeletal system are divided between the axial and appendicular skeletons. The axial skeleton forms the longitudinal axis of the body, from the skull to the tailbone, or coccyx. It includes the skull, facial bones, thoracic cage, and vertebral column. The appendicular skeleton comprises the upper and lower extremities, that is, arms and legs, and the points by which they connect with the axial skeleton, for example, the shoulder. The pelvis includes portions from both the axial and appendicular skeletons. Joints. A joint is where two bones meet. The names of most joints are formulated by combining the names of these adjoining bones. For example, the sternoclavicular joint is the articulation between the sternum and the clavicle. The fibrous tissues that connect bone to bone, helping to stabilize these joints, are called ligaments. The semi-rigid yet flexible tissue that covers and cushions the ends of articulating bones is called cartilage. Aided by the body's muscles, most joints permit a broad range of motion, for example, bending at the knee. The tissues that attach bone to muscle are called tendons. In other joints, called symphyses, only slight motion is possible. Last, some joints are fused to create solid, immobile, bony structures, for example, the cranial bones of the skull. The bone ends of a joint are held together by a fibrous sac called the joint capsule. This sac is composed of connective tissue, connecting bone to bone. At certain points around the joint, the capsule is lax and thin, permitting movement. In other areas, it is thick and resists stretching and bending. For example, while a joint such as the sacroiliac joint is virtually surrounded by tough, thick ligaments and will therefore have little motion, the shoulder, having fewer ligaments, is free to move in almost any direction, and will, as a result, be more susceptible to dislocation. In moving joints, the ends of the bones are covered with a thin layer of cartilage known as articular cartilage. This cartilage is a pearly white substance that allows the ends of the bones to glide easily. On the inner lining of the joint capsule is the synovial membrane. This special tissue is responsible for making a thick lubricant called synovial fluid. This oil-like substance allows the ends of the bones to glide over each other as opposed to rubbing and grating over each other. The degree to which a joint can move is determined by the extent to which the ligaments hold the bone ends together and also by the configuration of the bone ends themselves. The shoulder joint is a ball and socket joint, which allows rotation and bending. The finger joints, elbow, and knee are hinge joints, with motion restricted to flexion, bending, and extension, straightening. Rotation is not possible because of the shape of the joint surfaces, and the strong restraining ligaments on both sides of the joint. Although the amount of motion varies from joint to joint, all joints have a definite limit beyond which motion cannot occur. When a joint is forced beyond this limit, damage to some structure must occur. Either the bones that form the joint will break, or the supporting capsule and ligaments will be disrupted. The axial skeleton. The skull. The skull consists of 28 bones divided into 3 groups, the cranium, the facial bones, and 3 small bones in the ear. The cranium comprises the frontal bones, temporal bones, parietal bones, occipital bone, ethmoid bone, and sphenoid bone. Fused together, these bones encase and protect the brain. At the base of the cranium, a large opening called the foramen magnum, Latin for great opening, serves as the passageway for the spinal cord to connect with the brain, and descend into the spinal, or vertebral column. The 14 facial bones include the upper jaw bones, maxillae, the lower jawbone, mandible, and the cheek bones, zygomas. The orbit, or eye socket, is not a bone itself, it is a cavity formed by the joining of multiple facial bones. The upper third of the nose is made up of the very short nasal bones that form the bridge of the nose. The remaining 2/3 consist of flexible cartilage. The spinal column. The vertebral column, or spinal column, consists of 33 vertebrae. The vertebrae can be divided into 5 sections, with each vertebra labeled according to its respective section, and numbered from the top down. Cervical spine. The first 7 vertebrae, C1 through C7, in the neck form the cervical spine. The skull rests on and attaches to both the first cervical vertebra, the atlas, and the second cervical vertebra, the axis. The vertebrae fit together but move separately, allowing the head to turn in multiple directions. Thoracic spine. The next 12 vertebrae make up the thoracic spine. One pair of ribs is attached to each of the thoracic vertebrae. Lumbar spine. The next 5 vertebrae form the lumbar spine. Sacrum. The 5 sacral vertebrae are fused together to form one bone called the sacrum. The sacrum joins the iliac bones of the pelvis via strong ligaments at the sacroiliac joints. Coccyx. The last 4 vertebrae, also fused together, form the coccyx, or tailbone. The vertebrae are connected by ligaments, and the gaps between the vertebrae are occupied by cushioning, shock-absorbing structures called intervertebral discs. These ligaments and discs permit a limited degree of motion, while preventing any extreme movement that might harm the spinal cord. An injury to the vertebrae or the tissues between them has the potential to cause spinal cord damage. Use caution when assessing and treating patients presenting with a potential spinal injury, as mishandling may result in cord or other nerve damage. The thorax. The thorax, chest, contains the heart, lungs, esophagus, and great vessels, the aorta and the superior and inferior venae cavae. It is formed by the 12 thoracic vertebrae, T1 through T12, and their 12 pairs of ribs. Midline on the anterior surface of the chest is the sternum, breastbone. The sternum has 3 main parts, the manubrium, the body, and the xiphoid process. The manubrium is the uppermost section. The superior edge of the manubrium forms a landmark called the sternal notch. Immediately inferior to the manubrium is the sternal body, the largest bony section of the sternum. Last, the inferior tip of the sternum is formed by a narrow, cartilaginous structure called the xiphoid process. The appendicular skeleton. Upper extremities. The upper extremities, that is, arms, extend distally from the pectoral girdle, shoulder, which comprises the clavicle, that is, collarbone, and the scapula, shoulder blade. The medial end of the clavicle articulates with the manubrium of the sternum. This is the only joint that directly connects the shoulder girdle and the axial skeleton. The clavicle's lateral end articulates with the scapula. The scapula is supported and positioned by skeletal muscles, and has no bony or ligamentous connections to the thoracic cage. The scapula articulates with the proximal head of the humerus, the single bone of the upper arm. Distally, the humerus articulates with the 2 bones that make up the forearm, the radius on the lateral, or thumb, side and the ulna on the medial, or little finger, side. At their distal ends, the radius and ulna articulate with the proximal row of wrist bones, via a modified ball and socket joint. The 8 bones that form the wrist are called carpals. Extending from the carpals are 5 metacarpals, which form the palm of the hand. The metacarpals in turn articulate with the bones of the fingers, or phalanges. The thumb is composed of 2 phalanges, proximal and distal. The remaining 4 digits each contain 3 phalanges, proximal, middle, and distal. The pelvis. The pelvic girdle consists of 2 large hip bones called the coccyx, the sacrum, and the coccyx. Each coxa is formed by the fusion of 3 bones, the ilium, the ischium, and the pubis. Joining the left and right pubic bones is a cartilaginous articulation that limits movement between these 2 bones. This structure is called the pubic symphysis. The pelvis articulates with the femur bone of the leg at the hip joint, or acetabulum. The lower extremities. The femur, thigh bone, is the longest and one of the strongest bones in the body. The femur's rounded superior end is referred to as the femoral head. The femoral head articulates with the acetabulum of the pelvic girdle by a ball and socket joint. Immediately inferior and lateral to the head is the narrowed femoral neck. A projection called the greater trochanter is located proximal to the femoral head and neck on the lateral side of the femur. A second projection, called the lesser trochanter, is found on the medial side of the femur, just inferior to the femoral neck. Both trochanters serve as anchor points for the major muscles of the thigh. At the inferior end of the femur, a hinge joint commonly referred to as the knee connects the femur to the bones of the lower leg. The anterior side of the knee is covered by a specialized bone called the patella, kneecap. The lower leg comprises 2 bones, the tibia and the fibula. The larger of the 2, the tibia, shin bone, articulates with the inferior end of the femur at the knee joint, It is positioned on the medial side of the lower leg, and can be palpated along its entire length on the anterior surface of the leg, just beneath the skin. The smaller fibula lies on the lateral side of the lower leg. The ankle joint includes protrusions from the broad and distal ends of the tibia and fibula. On the lateral side, the fibula's lateral malleolus can be palpated. On the medial side, the prominence from the distal tibia is called the medial malleolus. Ankle and foot. The foot comprises the tarsals, metatarsals, and phalanges. The 7 tarsals include the large calcaneus, or heel bone, and the talus. The distal ends of the tibia and fibula articulate with the talus to form the ankle. The hinge joint of the ankle allows flexion and extension of the foot. The 5 metatarsal bones form the middle of the foot. The bottom surface of the foot is referred to as the plantar surface, while the top of the foot is described as the dorsum or dorsal surface. The 5 toes are formed by 14 phalanges, with 2 in the great toe, and 3 in each of the remaining toes. The skeletal system. Physiology. The skeletal system is responsible for several functions. It gives the body shape, provides protection of fragile organs, and allows for movement. Another function of the skeletal system is the storage of calcium. Associated with and in reaction to the normal stress from daily activity, the bones are continually broken down and rebuilt. Calcium is essential to the formation of hard, resilient bones. It is also vital to the function and well-being of other body systems. The heart, muscles, and nervous system are a few examples. The skeletal system also plays a crucial role in the creation of various types of blood cells and components. As the need arises, for example, existing blood cells die, specialized cells present in the marrow can be transformed into red blood cells, white blood cells, and platelets. The musculoskeletal system. Anatomy. Muscle is a form of tissue that facilitates movement. The human body contains 3 types of muscle: skeletal, smooth, and cardiac. Skeletal muscle, so named because it attaches to the bones of the skeleton, accounts for the bulk of human muscle mass. Because of its characteristic striped appearance, skeletal muscle is often referred to as striated muscle. It is also known as voluntary muscle because its movements are under our conscious control. By contrast, the activities of smooth muscle and cardiac muscle do not require conscious thought. You do not, for example, need to make your heart beat. For this reason, smooth and cardiac muscle are recognized as involuntary muscle. Smooth muscle is found within blood vessels and the intestines. When you hear your stomach growling, you are in fact hearing the rhythmic smooth muscle contractions of the intestines. Cardiac muscle is unique from other muscle types in that it can generate its own electrical impulses. Skeletal muscle. As the name implies, musculoskeletal is a term that refers to a partnership between bone and muscle. Thus, whenever we discuss the musculoskeletal system, we acknowledge this synergistic relationship. Voluntary movements, such as walking, raising your hand, and nodding your head, would not be possible otherwise. In most instances, a given motion, no matter how small, requires the simultaneous participation of multiple muscles. Skeletal muscles often function in antagonistic pairs. The muscles of the upper arm include the biceps muscle, which is located on the anterior aspect of the humerus. This muscle bends the elbow by moving the lower part of the arm toward the head. If the muscle were working alone, you would have little control over the speed of that movement. The way the body achieves control and fine movement is to have the biceps compete against another muscle group. The biceps competes with the triceps muscle, which is the 3-headed muscle of the back of the arm that functions to straighten the elbow. Without the triceps, you would slap yourself in the face every time you bend your arm. Conversely, the biceps works to slow the movement of the triceps as the arm is extended. There are more than 600 muscles in the musculoskeletal system. Figure 6-15 and Table 6-3 show the major muscles, their locations, and their functions. The musculoskeletal system. Physiology. The musculoskeletal system has several functions. One of these is the production of heat. When a person is cold, shivering begins. This involuntarily shaking of the muscles generates heat, thereby maintaining homeostasis, the body's self-regulating process for preserving internal balance, or equilibrium, in order to survive. Muscles also protect underlying structures, such as the internal organs. For example, the intestines are protected by the rectus abdominis muscles. The respiratory system. Anatomy. The respiratory system is the set of organs responsible for breathing, or respiration, and the exchange of oxygen and carbon dioxide that occurs within the lungs. It includes the nose, mouth, throat, larynx, trachea, bronchi, and bronchioles, which are all air passages or airways. The system also includes the lungs, where oxygen is passed into the blood and carbon dioxide removed. Finally, the respiratory system includes the diaphragm, the muscles of the chest wall, and accessory muscles of breathing, which permit normal respiratory movement. In this text, airway usually refers to the upper airway or the passage above the larynx, voice box. These structures are divided between the upper airway and lower airway. The upper airway. The structures of the upper airway are located anteriorly at the midline. In descending order, they include the following. Nasopharynx. Upper section of the pharynx that connects with the nasal cavity above the soft palate. Oropharynx. Section of the pharynx at the back of the throat, from the soft palate to the U-shaped hyoid bone near the base of the tongue. Laryngopharynx. Larynx, voice box. At the base of the larynx, the vocal cords, that is, glottis, mark the transition point from the upper airway to the lower airway. The nose and mouth lead to the oropharynx. The pharynx is composed of the nasopharynx, oropharynx, and the laryngopharynx. The nostrils lead to the nasopharynx, above the roof of the mouth, and soft palate, and the mouth leads to the oropharynx. The nasal passages and nasopharynx warm, filter, and humidify air as you breathe. Air enters through the mouth more rapidly and directly. As a result, it is less moist than air that enters through the nose. Food, liquids, and air all can travel through the oropharynx, but on reaching the laryngopharynx they must diverge, with food or liquids continuing posteriorly into the esophagus, while air proceeds to the anteriorly positioned larynx, voice box, and trachea, windpipe. The larynx does not tolerate any solid or liquid material, and any contact will result in a violent episode of coughing and spasm of the vocal cords. To help keep food and liquid out of the trachea while permitting air to pass, a thin, leaf-shaped flap, the epiglottis, covers the larynx during swallowing, and then lifts open to allow for air passage during breathing. The lower airway. Structures of the lower airway include the trachea, the bronchial tree, main stem bronchi and bronchioles, the alveoli, and the lungs themselves. The thyroid cartilage, Adam's apple, which tends to be more visible in men, is in the anterior midline portion of the neck. This cartilage is the anterior part of the larynx. Tiny muscles open and close the vocal cords and control tension on them. Sounds are created as air is forced past the vocal cords, making them vibrate. The pitch of the sound changes as the cords open and close. You can feel the vibrations if you place your fingers lightly on the larynx as you speak or sing. The vibrations of air are shaped by the tongue and muscles of the mouth to form understandable sounds. Immediately below the thyroid cartilage is the palpable cricoid cartilage. Between the thyroid and cricoid cartilage lies the cricothyroid membrane, which can be felt as a depression in the midline of the neck just inferior to the thyroid cartilage. Below the cricoid cartilage is the trachea. The trachea is approximately 5 inches, 13 cm, long and is a semi-rigid, enclosed air tube made up of rings of cartilage that are open in the back. The rings of cartilage keep the trachea from collapsing when air moves into and out of the lungs. Air and other gases enter the trachea, and proceed to the lungs. The two lungs are held in place by the trachea, the arteries and veins, and the pulmonary ligaments. Each lung is divided into lobes. The right lung has 3 lobes, upper, middle, and lower. The left lung has 2, an upper lobe, and a lower lobe. Each lobe is divided further into segments. The lungs are supplied air by the right and left main stem bronchi, which are two tubes that branch from the trachea at a structure called the carina. See Figure 6-16. Each bronchus enters its respective lung and branches into smaller and smaller airways called bronchioles. The bronchioles end in about 700 million tiny, grape-like clusters of air sacs called alveoli. It is within these alveolar sacs that oxygen and carbon dioxide are exchanged between the lungs and the bloodstream. The respiratory structures covered thus far serve as a pathway by which air can reach the alveoli. The alveoli are referred to as the functional units of the respiratory system. The walls of the alveoli contain a network of tiny blood vessels, pulmonary capillaries, that carry carbon dioxide from the body to the lungs, for removal through exhalation, and oxygen from the lungs to the body. Mechanics of breathing. For air to flow in and out of the lungs must be able to expand and relax. The lungs cannot accomplish this on their own, because they are without muscle tissue. However, an effective mechanism is in place to ensure that the lungs follow the motion of the chest wall, expanding and contracting with it. Covering each lung is a layer of smooth, glistening tissue called pleura. Another layer of pleura lines the inside of the chest cavity. The two layers are called visceral pleura, covering the lungs, and parietal pleura, lining the chest wall. Between these two layers is a small amount of fluid that permits smooth gliding of the tissues. This is similar in concept to how joints work. Between the parietal pleura and the visceral pleura is the pleural space, called a potential space because under normal conditions, the space does not exist. These two layers are usually sealed tightly to one another by a thin film of fluid. When the chest wall expands, the lung is pulled with it and made to expand by the force exerted through these closely applied pleural surfaces. When blood or air leaks into the pleural space, however, the surfaces separate. Muscles of breathing. There are several muscles involved in making the lungs expand and contract. The primary muscle of breathing is the diaphragm. The diaphragm is unique because it has characteristics of voluntary, skeletal, and involuntary, smooth, muscles. It is a dome-shaped muscle that divides the thorax from the abdomen, and is pierced by the great vessels, and the esophagus. It acts like a voluntary muscle when you take a deep breath, cough, or hold your breath. You control these variations in the way you breathe. However, unlike other skeletal or voluntary muscles, the diaphragm performs an automatic function. Breathing continues during sleep, and at all other times. Even though you can hold your breath or temporarily breathe faster or slower, you cannot continue these variations in breathing pattern indefinitely. When the concentration of carbon dioxide becomes too high, automatic regulation of breathing resumes. Therefore, although the diaphragm looks like voluntary skeletal muscle, and is attached to the skeleton, it behaves, for the most part, like an involuntary muscle. The other muscles involved in breathing are the neck, cervical muscles, the intercostal muscles, the abdominal muscles, and the pectoral muscles. During inhalation, the diaphragm and intercostal muscles contract. When the diaphragm contracts, it moves down slightly, enlarging the thoracic cage from top to bottom. When the intercostal muscles contract, they move the ribs up and out. These actions combine to enlarge the chest cavity in all dimensions. As the volume of the chest cavity increases, pressure in the cavity falls, and air rushes into the lungs. This is referred to as negative pressure breathing because air is essentially sucked into the lungs. This part of the cycle is active, requiring the muscles to contract. During exhalation, the diaphragm and the intercostal muscles relax. Unlike inhalation, exhalation does not normally require muscular effort. As these muscles relax, all dimensions of the thorax decrease, and the ribs and muscles assume a normal resting position. When the volume of the chest cavity decreases, air in the lungs is compressed into a smaller space. Pressure is increased, and air is pushed out through the trachea. This phase of the cycle is passive. The process of breathing is typically easy and requires little muscular effort. But, now imagine breathing through a straw. and suddenly the diameter of the straw decreases. The smaller the diameter of the straw, the more effort you will have to exert to move air. As the resistance in the airway increases, you will begin to use accessory muscle groups, namely your abdominal and pectoral muscles, to assist the diaphragm in moving the air. The respiratory system. Physiology. The function of the respiratory system is to provide the body with oxygen and eliminate carbon dioxide. The exchange of oxygen and carbon dioxide takes place in the lungs and in the tissues. It is a complicated process that occurs automatically unless the airways or the lungs become diseased or damaged. There are two separate yet interdependent overall functions of the respiratory system: ventilation and respiration. Ventilation is simply the movement of air between the lungs and the environment. It requires chest rise and fall. You are providing artificial ventilation when you assist a patient who is not breathing with a bag mask device, a large bag filled with air that, when squeezed, pushes air out one end. The typical device holds approximately 1,000 to 1,200 milliliters of air. Bag mask devices are designed to rapidly reinflate and allow you to control the amount of air that is moved to achieve chest rise and fall in any given patient. Artificial ventilation is provided in the hope that your patient will resume respiration. Respiration is the process of gas exchange. Respiration provides the much-needed oxygen to cells and removes the waste product carbon dioxide. This exchange of gases also helps to control the potential hydrogen of the blood. Respiration. As blood travels through the body, it delivers oxygen and nutrients to cells. At the capillaries, the oxygen is offloaded from red blood cells. It passes through the thin capillary wall and enters the tissue cells, where it is used to produce energy. Carbon dioxide and cell wastes are transported in the reverse, leaving the cells, crossing the capillary walls, and entering the bloodstream. Each time you take a breath, the alveoli receive a supply of oxygen-rich air. Recall that the oxygen then passes into a network of pulmonary capillaries, which are located in the walls of the alveoli. The walls of the capillaries and the alveoli are extremely thin. Thus, air in the alveoli and blood in the capillaries are only separated by two thin layers of tissue. Oxygen and carbon dioxide pass rapidly across these thin tissue layers by diffusion. Diffusion is a passive process in which molecules move from an area with a higher concentration of molecules, oxygen in the air, to an area of lower concentration, oxygen in the bloodstream. There are more oxygen molecules in the alveoli than in the blood. Therefore, the oxygen molecules move from the alveoli into the blood. Because there are more carbon dioxide molecules in the blood than in the inhaled air, carbon dioxide moves from the blood into the alveoli. This process is completely passive. Nature does all the work. The blood does not use all the inhaled oxygen as it passes through the body. Exhaled air contains 16% oxygen and 3% to 5% carbon dioxide, the rest is nitrogen. The chemical control of breathing. The brain, specifically, the brainstem, controls breathing. The nerves in this area act as sensors for the level of carbon dioxide in the blood, and subsequently the spinal fluid. The brain automatically controls breathing if the level of carbon dioxide or oxygen in the arterial blood is too high or too low. In fact, adjustments can be made in just one breath. For these reasons, you cannot hold your breath indefinitely or breathe rapidly and deeply indefinitely. Breathing occurs as the result of a buildup of carbon dioxide, which causes the potential hydrogen to decrease in the cerebrospinal fluid. Cerebrospinal fluid is a colorless fluid in and around the brain and spinal cord that cushions these structures and filters out impurities and toxins. The cells are constantly working to eliminate carbon dioxide to regulate the acid-alkaline balance of the body. When the level of carbon dioxide becomes too high, a slight change occurs in the potential hydrogen, the measure of acidity, of the cerebrospinal fluid. The medulla oblongata, a portion of the brainstem, which is sensitive to potential hydrogen changes, stimulates the phrenic nerve, sending a signal to the diaphragm to increase its rate of contraction. As the diaphragm becomes more active, the respiratory rate and tidal volume increase, discussed later in this chapter. As minute volume increases, more carbon dioxide is exhaled. The primary reason you breathe is to lower your level of carbon dioxide, not to increase your level of oxygen. The body also has a backup system to control respiration called the hypoxic drive. When the oxygen level falls, this system will also stimulate breathing. There are areas in the brain, the walls of the aorta, and the carotid arteries that act as oxygen sensors. These sensors are easily satisfied by minimal levels of oxygen in the arterial blood. Therefore, the backup system, the hypoxic drive, is much less sensitive and less powerful than the carbon dioxide sensors in the brainstem. The nervous system control of breathing. The exact way breathing occurs is complicated and also poorly understood by science. It is known that the medulla oblongata is primarily responsible for initiating the ventilation cycle, and is primarily stimulated by high carbon dioxide levels. The function of the medulla is to keep you breathing without having to think about it. The medulla helps control the rhythm of breathing, initiates inspiration, sets the base pattern for respirations, and sends signals down the phrenic nerve to the diaphragm, triggering it to contract. The pons, another area within the brainstem, has two areas, both of which help augment respirations during emotional or physical stress. The pons is involved in changing the depth of inspiration, expiration, or both. The medulla and the pons work together to help you get the right amount of air when you need it. The anatomy and physiology of the nervous system are discussed in more detail later in this chapter. Ventilation. A substantial amount of air can be moved within the respiratory system. Figure 6-23 shows the typical volumes. An adult man has a total lung capacity of 6,000 milliliters, equivalent to 3 2-liter bottles of soda. An adult woman has about 1/3 less total capacity because the lung size is smaller. Tidal volume is the amount of air that is moved into or out of the lungs during a single breath, generally 500 milliliters in an adult. Inspiratory reserve volume is the deepest breath you can take after a normal breath. Conversely, expiratory reserve volume is the maximum amount of air that you can forcibly breathe out after a normal breath. Gas remains in the lungs after exhalation simply to keep the lungs open. This is the residual volume. A loss of residual volume occurs when a person is hit in the chest, and has the wind knocked out of him or her. Dead space is the portion of the respiratory system that has no alveoli, and, therefore, little or no exchange of gas between air and blood occurs. The mouth, trachea, bronchi, and bronchioles are all considered dead space. When you ventilate a patient with any device, you create more dead space. Gas must first fill the device before it can be moved into the patient. When you assess your patient, you need to accurately determine whether he or she is having trouble breathing. Often, emergency medical technicians will look at the patient's respiratory rate. This rate, however, provides only part of the information that is needed. The depth of each breath is critical information to know when assessing ventilation. Minute volume is another measure used to assess ventilation. It is the amount of air that moves in and out of the lungs in 1 minute. Minute volume equals respiratory rate times tidal volume. This calculation helps you to determine if a patient is breathing adequately. While riding in the ambulance, it will be difficult to determine the patient's exact tidal volume, but you will be able to estimate it. Consider the scenario of a patient who is breathing at a normal rate of 20 breaths per minute. Yet, when you look at the patient's chest, it is barely moving. When you feel for air movement out of the mouth, you find very little movement. The patient is in trouble and needs your assistance now. Even though the patient's respiratory rate is normal, the amount of air being moved is inadequate. The minute volume is too low, and the patient needs ventilatory assistance. Always evaluate the amount of air being moved with each breath when assessing a patient's respirations. Characteristics of normal breathing. You can think of a normal breathing pattern as a bellows system. Normal breathing should appear easy, not labored. As with a bellows that is used to move air to start a fire, breathing should be a smooth flow of air moving into and out of the lungs. Normal breathing has the following characteristics. And normal rate and depth. Tidal volume. A regular rhythm or pattern of inhalation and exhalation. Clear, audible breath sounds on both sides of the chest. Regular rise and fall movement on both sides of the chest. Movement of the abdomen. Inadequate breathing in adults. An awake and alert adult speaking to you in full sentences usually has no immediate airway or breathing problem. An adult who is not breathing well may appear to be working hard to breathe. Labored breathing is characterized by significant effort, and may require the use of accessory muscles in the chest, neck, and abdomen. The person may also be breathing much slower, fewer than 12 breaths per minute, or much faster, more than 20 breaths per minute, than normal. An adult at rest who is breathing normally will have respirations of 12 to 20 breaths per minute. Other signs that a person is not breathing normally include the following. Muscle retractions above the clavicles, between the ribs, and below the rib cage, especially in children. Pale or cyanotic, blue, skin. Cool, damp, clammy, skin. Tripod position, a position in which the patient leans forward onto two arms. A patient in cardiac arrest may appear to be breathing. These occasional, gasping breaths are called agonal gasps, and occur when the respiratory center in the brain continues to send signals to the breathing muscles. However, these gasps are inadequate because they come at a slow rate, and are generally shallow. Patients with agonal gasps need artificial ventilations and, most likely, chest compressions. Both topics will be discussed in later chapters. The circulatory system. Anatomy. The circulatory system is a complex arrangement of connected tubes, including the arteries, arterioles, capillaries, venules, and veins. Another name for this system is the cardiovascular, heart or blood vessels, system. The circulatory system is entirely closed, with capillaries connecting arterioles and venules. There are two circuits in the body, the systemic circulation in the body, and the pulmonary circulation in the lungs. The systemic circulation, the circuit in the body, carries oxygen-rich blood from the left ventricle through the body, and back to the right atrium. In the systemic circulation, as blood passes through the tissues and organs, it gives up oxygen and nutrients and absorbs cellular wastes and carbon dioxide. Many cellular wastes are eliminated in passages through the liver and kidneys. The pulmonary circulation, the circuit in the lungs, carries oxygen-poor blood from the right ventricle through the lungs, and back to the left atrium. In the pulmonary circulation, as blood passes through the lungs, it is refreshed with oxygen, and gives up carbon dioxide. The heart. The heart is a hollow muscular organ approximately the size of a clenched fist. It is made of a specialized muscle tissue called cardiac muscle or myocardium, and works as two paired pumps. The left side is more muscular. A wall called the septum divides the heart down the middle into right and left sides. Each side of the heart is divided again into an upper chamber, atrium, and a lower chamber, ventricle. The left side of the heart, which pumps blood to the body, is a high-pressure pump. The right side supplies blood to the lungs, and is a low-pressure pump. The heart is an involuntary muscle. As such, it is under the control of the autonomic nervous system. However, it has its own electrical system, and continues to function even without its central nervous system control. It is also unlike skeletal and smooth muscle in its requirement for a continuous supply of oxygen and nutrients, as it cannot function on anaerobic metabolism. The heart must function continuously from birth to death, and has developed special adaptations to meet the needs of this continuous function. It can tolerate a serious interruption of its own blood supply for only a few seconds before the signs of a heart attack develop. Thus, its blood supply is rich and well distributed. Circulation. The heart muscle's blood supply comes from the aorta. The aorta has two branches at its base that form the left and right coronary arteries. These arteries supply the heart muscle with oxygenated blood. The right side of the heart receives blood from the veins of the body. The blood enters from the superior and inferior venae cavae into the right atrium, and then passes through the tricuspid valve to fill the right ventricle. After the right ventricle is filled, the tricuspid valve closes to prevent backflow as the right ventricular muscle contracts. Contraction of the right ventricle causes blood to flow through the pulmonic valve into the pulmonary artery, and the pulmonary circulation. The left side receives oxygenated blood from the lungs through the pulmonary veins into the left atrium, where the blood passes through the mitral valve into the left ventricle. Contraction of this most muscular of the pumping chambers pumps the blood through the aortic valve into the aorta, and then to the arteries of the body. The flow of blood through the four heart chambers is governed by one-way valves. The valves prevent the backflow of blood, and keep it moving through the circulatory system in the proper direction. The chordae tendineae are thin bands of fibrous tissue that attach to the valves in the heart, and prevent them from inverting. When a valve controlling the filling of a heart chamber is open, the other valve allowing it to empty is shut, and vice versa. Normally, blood moves in only one direction through the entire system. Normal heartbeat. In the normal adult, the resting heartbeat may range from 60 to 100 beats per minute. A well-conditioned athlete may have a normal resting heart rate of 45 to 60 beats per minute. During vigorous physical activity, the heart rate may rise to as fast as 180 beats per minute until the activity stops. At each beat, 70 to 80 milliliters of blood is ejected from the adult heart. The amount of blood moved in one beat is called the stroke volume. In 1 minute, the entire blood volume of 5 to 6 liters is circulated through all the vessels. The amount of blood moved in 1 minute is called the cardiac output. Cardiac output is equal to heart rate times stroke volume. Mathematically, cardiac output can be expressed as follows. Cardiac output equals heart rate times stroke volume. For example, 70 beats per minute times 75 milliliters per beat equals 5,250 milliliters per minute or 5.25 liters per minute. Electrical conduction system. A network of specialized tissue with the capacity to conduct electrical current runs throughout the heart. The flow of electrical current through this network causes smooth, coordinated contractions of the heart. These contractions produce the pumping action of the heart. Each mechanical contraction of the heart is associated with two electrical processes. The first is depolarization, during which the electrical charges on the surface of the muscle cell change from positive to negative. The second is repolarization, during which the heart returns to its resting state, and the positive charge is restored to the surface. When the heart is working normally, the electrical impulse begins high in the atria at the sinoatrial node, then travels to the atrioventricular node and bundle of His, and moves through the Purkinje fibers to the ventricles. This movement produces a smooth flow of electricity through the heart, which depolarizes the muscle, and produces a coordinated pumping contraction. Just as the walls of the heart can be injured when deprived of blood flow and oxygen, if areas of the heart's conduction system are deprived of blood flow and oxygen, serious abnormalities of the heart's rate, rhythm, and coordinated contraction can occur. Simply put, when the conduction system is injured, the heart will not beat properly. This may lead to dangerously low blood pressure, which, if untreated, can result in the patient experiencing a loss of consciousness or cardiac arrest. Blood pressure is discussed later in the chapter. Arteries. The arteries carry blood from the heart to all body tissues. They branch into smaller arteries, and then into arterioles. The arterioles, in turn, branch into the vast network of capillaries. The walls of an artery are made of fine, circular muscle tissue. Some arteries are made of fine circular muscle and elastic tissue. Arteries contract to accommodate loss of blood volume and increase blood pressure. Blood is supplied to tissues as they need it. For example, the digestive system is supplied with more blood after you eat a meal. The leg muscles are more heavily supplied when jogging. Some tissues need a constant blood supply, especially the heart, kidneys, and brain. Other tissues, such as the muscles in the extremities, the skin, and intestines, can function with less blood when at rest. The ability to respond to the needs of the body is possible because of the way arteries are constructed. The middle layer of the artery is the tunica media, formed from smooth muscles that can contract, and dilate to change the diameter of the blood vessel. The aorta is the main artery leaving the back left side of the heart. It carries freshly oxygenated blood to the body. This blood vessel is found just in front of the spine in the chest and abdominal cavities. The aorta has many branches that supply the body's vital organs. The coronary arteries supply the heart, the carotid arteries supply the head, the hepatic arteries supply the liver, the renal arteries supply the kidneys, and the mesenteric arteries supply the digestive system. The aorta divides at the level of the umbilicus into the two common iliac arteries that lead to the lower extremities. All branches of the aorta ultimately become arterioles leading into the body's capillary network. The pulmonary artery begins at the right side of the heart, and carries oxygen-depleted blood to the lungs. It divides into finer and finer branches until it meets with the pulmonary capillary system located in the thin walls of the alveoli. These arteries are the only ones in the body that carry oxygen-depleted blood. Arteries branch into smaller arteries, and then into arterioles. Arterioles are the smallest branches of an artery leading to the vast network of capillaries. The pulse, which is palpated most easily at the neck, wrist, or groin, is created by the forceful pumping of blood out of the left ventricle and into the major arteries. It is present throughout the entire arterial system. It can be felt most easily where the larger arteries near the skin can be pushed against a solid structure, such as a bone or large muscle. Pulses and their locations are listed in Table 6-5. Capillaries. In the body, there are billions of cells and billions of capillaries. Capillary vessels are fragile divisions of the arterial system that allow contact between the blood and the cells of the tissues. Oxygen and other nutrients pass from blood cells and plasma in the capillaries to the individual tissue cells through the thin wall of the capillary. Carbon dioxide and other metabolic waste products pass in a reverse direction from the tissue cells to the blood to be carried away. Blood in arteries is characteristically bright red, because its hemoglobin is rich in oxygen. Blood in the veins is dark blue-red, because it has passed through a capillary bed and given up its oxygen to the cells. Capillaries connect directly at one end with the flow-regulating arterioles and at the other with the venules. Capillaries allow blood to move through them a single cell at a time. Veins. Once oxygen-depleted blood passes through the network of capillaries, it moves to the venules, which are the smallest branches of the veins. The blood returns to the heart via a network of larger and larger veins. Veins have much thinner walls than arteries, and are generally larger in diameter. The veins become larger and ultimately form two major vessels, called the superior and inferior vena cavae. These two veins lie just to the right of the spine, and collect blood just before it enters the heart. Because pressure generated by the heart dissipates as blood passes through the capillaries, venous blood flow is assisted by gravity, skeletal muscle contraction, and intrathoracic pressure changes from breathing. One-way flow in the veins is governed by valves within the veins. The superior vena cava carries blood returning from the head, neck, shoulders, and upper extremities. Blood from the abdomen, pelvis, and lower extremities passes through the inferior vena cava. The superior and inferior vena cavae join at the right atrium of the heart. The right ventricle receives blood from the right atrium and pumps it through the pulmonary arteries into the lungs. The vena cavae, aorta, and pulmonary arteries and veins are collectively known as the great vessels. Recall that the body's ability to change blood flow is critical to survival. The body constricts blood vessels to change the size of the total blood volume container. A smaller container that has the same amount of liquid as the original container means a higher liquid pressure. The state of the blood vessels, how dilated or constricted they are, is referred to as the systemic vascular resistance. Systemic vascular resistance is the resistance to blood flow within all blood vessels except the pulmonary vessels. The pathophysiology section of this chapter will discuss how various types of shock affect container size. In some types of shock, blood vessels dilate, the container becomes too large, and the patient's blood pressure falls dramatically. Blood composition. Blood is composed of plasma, red blood cells, white blood cells, platelets, and protein molecules. Red blood cells, or erythrocytes, contain hemoglobin, a protein responsible for carrying oxygen. Most carbon dioxide is carried in the form of bicarbonate dissolved in the plasma, while a tiny amount of carbon dioxide is carried by hemoglobin. White blood cells, or leukocytes, play an important role in the body's immune defense against infection. Platelets are tiny, disc-shaped elements that are much smaller than the cells. They are essential in the initial formation of a blood clot, the mechanism that stops bleeding. Plasma is the liquid portion of the blood that carries the blood cells, hormones, and nutrients. About 99% of its composition is water and proteins. Its composition can be broken down as follows. Water constitutes 92% of plasma. Proteins constitutes 7% of the plasma. The majority of this protein is albumin, which has a role in controlling the movement of water into and out of the circulation. Also include clotting factors, enzymes, and some hormones. Oxygen. Very little oxygen is dissolved in the plasma, most is bound to the hemoglobin found in red blood cells. Carbon dioxide. Transported as bicarbonate in the plasma. Nitrogen. Accounting for roughly 78% of the air we breathe, this gas is dissolved within the plasma. Nutrients. Fuel for the cells. Cellular wastes. Lactic acid, carbon dioxide, etc. Others. Hormones, other cellular products. The spleen. The spleen is a solid organ located under the rib cage in the left upper quadrant of the abdomen. Although it is a lymphatic organ, it plays an important supportive role for the circulatory system. Red blood cells have a lifespan of about 120 days. As they age and degrade, they are filtered from the bloodstream and digested in the spleen and liver. Hemoglobin is then recycled. Because its tissue is delicate and due to its position directly under flexible ribs, with very little soft tissue to cushion it, the spleen is one of the most frequently injured abdominal organs after blunt trauma. And because it is so highly vascular, an injured spleen can produce significant internal bleeding. The circulatory system. Physiology. Blood pressure is the force of circulating blood against the walls of the arteries. This pressure wave keeps the blood moving through the body. When the left ventricle of the heart contracts, it pumps blood into the aorta. This phase in the cardiac cycle is called systole. The pressure inside the arteries during this time is referred to as the systolic blood pressure. The time between contractions when the ventricle is relaxed and refilling with blood is called diastole. The resting pressure in the arteries during this phase is the diastolic blood pressure. The values of the systolic and diastolic pressures are measured with a sphygmomanometer, blood pressure cuff, and are expressed numerically in millimeters of mercury. Blood pressure is displayed as the systolic number over the diastolic number. Additional cardiovascular values of importance are shown in Table 6-7. The average adult has approximately 6 liters of blood. Children have 2 to 3 liters, depending on age and size. Infants have about 300 milliliters. Thus, while the loss of a relatively small amount of blood might be insignificant for an adult, an equal amount of blood loss in an infant could be fatal. Normal circulation in adults. In all healthy people, the circulatory system is automatically adjusted and readjusted constantly so that 100% of the capacity of the arteries, veins, and capillaries holds 100% of the blood at that moment. All of the vessels are never fully dilated or constricted. The size of arteries and veins is controlled by the nervous system, according to the amount of blood that is available and many other factors, to keep blood pressure normal at all times. Under the condition of normal pressure, with a system that can hold just 100% of the blood available, all parts of the system will have adequate blood supply all the time. Perfusion is the circulation of blood in an organ or tissue. When perfusion is adequate, the cell's metabolic needs are met. Blood enters an organ or tissue through the arteries, and leaves it through the veins. Loss of normal blood pressure is an indication that blood is no longer circulating efficiently to every organ in the body. However, A good blood pressure does not indicate that it is reaching all parts of the body. There are many reasons for loss of blood pressure. The result in each case is the same. Organs, tissues, and cells are no longer adequately perfused or supplied with oxygen and fuel, and wastes accumulate. Under these conditions, cells, tissues, and whole organs may die. Hypoperfusion, inadequate perfusion, affecting the entire body is called shock. Inadequate circulation in adults. When a patient has a small amount of blood loss, the arteries, veins, and heart automatically adjust to the smaller volume. The adjustment occurs to maintain adequate pressure throughout the circulatory system, and maintain circulation for every organ. The adjustment occurs rapidly after the loss, usually within minutes. Specifically, the vessels constrict to provide a smaller bed for the reduced volume of blood to fill, and the heart pumps more rapidly to circulate the remaining blood more efficiently. As the blood pressure falls, the pulse increases to keep the cardiac output constant at 5 to 6 liters per minute. If the loss of blood is too great, the adjustment fails, and the patient goes into shock. One measure of perfusion that can detect shock, and that is often displayed on automated blood pressure monitors, is mean arterial pressure. The mean arterial pressure indicates the average arterial pressure during systole and diastole. This can be expressed by the following formula, in which MAP is mean arterial pressure, HD is heart rate, SV is stroke volume, and SVR is systemic vascular resistance. MAP equals heart rate times stroke volume times SVR. Since heart rate times stroke volume equals cardiac output, this can also be written as MAP equals cardiac output times SVR. Figure 6-31 illustrates this formula. The function of blood. Most blood is unevenly distributed throughout the body. Approximately 30% of blood is found within the heart, arteries, and capillaries. 70% of blood is found within the veins and venules. This may seem confusing, but if you remember that the heart and arteries are high-pressure systems and veins are low-pressure systems, it becomes clearer. As blood pressure falls, blood flow slows down and there is more blood in the veins. The blood flows away from the left ventricle, and moves back to the right atria. Consider the movement of blood, and its ultimate function of perfusion. You know that capillaries are the smallest portions of the circulatory system, where materials are able to exit and enter the bloodstream. Nutrients move from the capillaries into the interstitial space between the cells, and into the intracellular space, within the cell. Wastes move from the cells through the interstitial space, and into the capillaries. Inside the capillary, two main forces are at work, hydrostatic pressure and oncotic pressure. Hydrostatic pressure occurs as fluid pushes against the vessel walls to force fluid out of the capillary. Oncotic pressure is the opposing force, and occurs because proteins in the blood plasma cause water to be pulled into the capillary by diffusion. The movement of fluid into and out of the capillaries occurs as follows. Blood flows into the arterial side of the capillary. Water is forced out because the pressure is high. At the same time, water is trying to enter the capillary. Pressure on the arterial side is higher, so the hydrostatic pressure is also higher, and water, carrying nutrients, leaves the capillary and enters the interstitial space. The hydrostatic pressure is greatly diminished, however, by the time the fluid reaches the venous side because the effort of pushing the fluid out of the capillary decreased its force. This decrease in pressure is beneficial because oncotic pressure is still pulling fluid into the capillary and the pressure is higher. Water, with all of the wastes from the cells, enters the venous side of the capillary. These wastes are then carried away. Another function of blood is the ability to clot. Coagulation, or clotting, occurs as the result of a complex chemical process that creates small fibers near the injured blood vessel, trapping red blood cells. This chemical process involves platelets and clotting factors that are in the bloodstream. Table 6-8 outlines the major functions of the blood. Blood under pressure will gush or spurt intermittently from an artery. When blood comes from a vein, it flows in a steady stream. From capillaries, blood will ooze at many tiny individual points. Clotting after venous or capillary bleeding normally takes from 6 to 10 minutes. Nervous system control of the cardiovascular system. The nervous system, discussed next, has direct effects on the cardiovascular system. The sympathetic nervous system sends commands to the adrenal glands, which sit atop the kidneys, where two hormones, epinephrine, also known as adrenaline, and norepinephrine, also known as noradrenaline, are secreted to stimulate the heart and blood vessels. The release of epinephrine and norepinephrine affects receptors within the heart and blood vessels and improves the ability to cope with stress, known as the fight or flight reaction. Two types of receptors within the heart and blood vessels will be discussed next so you can understand how the nervous system controls the circulatory system. The heart and blood vessels have alpha adrenergic receptors and beta adrenergic receptors within them. Adrenergic simply means related to the adrenal gland, where epinephrine and norepinephrine are made. The alpha adrenergic receptors are found in the blood vessels. When stimulated, the blood vessels constrict, thereby increasing blood pressure. The beta adrenergic receptors are found in the heart and lungs. When beta-1 receptors are stimulated, they cause the heart to increase its rate, and also squeeze harder with each contraction. This increases cardiac output. When beta-2 receptors are stimulated, the bronchi in the lungs dilate. This allows more air to be inhaled and exhaled, therefore, more oxygen is available to the cells of the body. Together, the alpha and beta adrenergic receptors prepare the body for fight or flight. The parasympathetic nervous system also has effects on the cardiovascular system. When stimulated, this system causes the heart to slow and beat more weakly. Although the sympathetic and parasympathetic divisions function in opposition to each other, this opposition is considered complementary rather than antagonistic. The net effect is a dynamic body able to respond quickly for fight or flight. The brain needs to know how the body is performing so that adjustments in the pressure exerted by circulating blood can be made. How is the brain alerted to what is happening at the feet, the liver, or the heart? Signals are sent through the nervous system from special pressure sensors, baroreceptors, spread throughout the body, which allow the brain to receive information about blood pressure. Remember, the main function of the cardiovascular system is to perfuse blood throughout the body. The main locations for these pressure receptors are found in the arch of the aorta and the carotid arteries. By measuring the pressure in these two locations, the body can ensure that the most vulnerable and most important cells get oxygen. With this information, the brain is able to act to maintain perfusion. To see the system in action, you may want to try this test. Kneel down to the floor. Now, as fast as you can, jump up. Did you pass out? Most likely you did not pass out because these systems with their pressure sensors are designed to maintain perfusion. When you jumped up quickly, gravity was relocating the blood out of your brain. The baroreceptors detected the decrease in blood pressure at the carotid arteries. A signal was sent to the brain. The brain understood the implication of low blood pressure, and immediately turned on the sympathetic nervous system. The blood vessels contracted, and the heart rate increased. The heart pumped harder. Your blood pressure returned to normal and may even have gone slightly high. Again, the baroreceptors detected this change. Signals were sent to the brain. The sympathetic nervous system was turned off. The parasympathetic nervous system was turned on. The heart rate slowed, and the force of the heart's contractions weakened. All of this happened in a fraction of a second. That is how responsive the cardiovascular system can be. The nervous system. Anatomy and physiology. The nervous system is perhaps the most complex organ system within the human body. It comprises the brain, spinal cord, and thousands of nerves spread throughout the body. This system has many functions, such as the control of breathing, heart rate, and blood pressure. However, what makes the nervous system so special is that it allows the performance of higher-level activity. Reading a good book, enjoying music, having a discussion with a friend, and even watching television require the brain to engage memory, understanding, and thought. This is where the true complexity of the nervous system is revealed. The nervous system is divided into two main portions: the central nervous system, the brain and spinal cord, and the peripheral nervous system, the nerves outside of the brain and spinal cord that link the central nervous system to various organs throughout the body. The peripheral nervous system can be further divided into the somatic and autonomic nervous systems. The somatic nervous system regulates activities over which we have voluntary control, such as walking, talking, and writing. The autonomic nervous system controls those functions that occur autonomously, that is, automatically, including digestion, dilation and constriction of blood vessels, sweating, and other involuntary actions. The central nervous system. Brain. The brain controls all functions of the body, and it assembles and interprets the information received through the body's various senses. It stores information in memory, it controls thought, speech, movement of skeletal muscle, and involuntary processes such as heart and breathing rates. The brain is subdivided into several components, all of which have specific roles. Three major subdivisions of the brain are the cerebrum, the cerebellum, and the brainstem. The cerebrum accounts for the largest portion of the brain, about 3/4. Its surface, the cortex, is made up of neurons, nerve cell bodies, which give it a gray-brown color, thus the reason why the cerebrum is sometimes called the gray matter. The cerebrum is responsible for higher brain functions, such as interpreting what we see, hear, or feel, encoding and decoding speech, reasoning and learning, controlling precise muscle movements, that is, fine motor control, and managing emotions. The cerebrum can be divided into right and left halves, or hemispheres. These hemispheres can be further divided into lobes. In general, control of one side of the body belongs to the hemisphere on the opposite side. For example, the left hemisphere controls the movements of the right leg. Each hemisphere has 4 lobes: frontal, parietal, temporal, and occipital. No single lobe operates entirely on its own. Complex relationships exist between them and with other parts of the brain. However, each lobe has a certain set of duties for which it is recognized as having the greatest degree of control. For example, personality, judgment, planning, problem-solving, concentration, and self-awareness all are attributed to the frontal lobe. The parietal lobe controls our recognition of spatial relationships, and it integrates sensory information received from the body to form our perception of the world around us. The occipital lobe is responsible for vision, taste, hearing, and our ability to understand words. All are functions of the temporal lobe. Located beneath the cerebrum is the cerebellum, a structure that controls balance, muscle coordination, and posture. Without the cerebellum, highly specialized muscular activities such as writing would be impossible. Deep within the cranium, the well-protected brainstem acts as a relay center connecting the cerebrum and cerebellum to the spinal cord. It is the most primitive part of the central nervous system, controlling virtually all involuntary, life-sustaining functions, such as heart rate, breathing, temperature regulation, digestion, vomiting, swallowing, coughing, and the wake or sleep cycle. The brainstem comprises the midbrain, the pons, and the medulla oblongata. One noteworthy feature within the brainstem is a network of neurons called the reticular activating system. One of its functions is to regulate consciousness. When stimulated, it wakes the cerebral cortex. Without the reticular activating system, wakefulness and awareness would not be possible. When someone experiences a concussion from a head injury, the immediate loss of consciousness is due to a momentary interruption in the reticular activating system. Much like a computer having to reboot, the reticular activating system must reboot for the patient to regain conscious awareness. The brain has many other anatomic elements, all of which have important functions. Table 6-10 summarizes several key components of the nervous system and their functions. Cerebrospinal fluid. In addition to filtering out impurities and toxins, cerebrospinal fluid absorbs shocks. When significant forces are applied to the head, cerebrospinal fluid allows the brain to shift inside the skull without being damaged. Some skull fractures may allow cerebral spinal fluid to leak from the ears or nose. This is considered a significant finding. Refer to Chapter 29, Head and Spine Injuries, for more information. Circulation in the head. The brain requires a constant flow of oxygenated blood. Blood is supplied to the head through the carotid arteries, which can be palpated on either side of the neck. Deoxygenated blood drains from the head via the internal and external jugular veins. Spinal cord. The spinal cord is an extension of the brainstem. The opening at the base of the cranium, which allows the brain and cord to connect, is called the foramen magnum. The spinal cord then travels downward, encased within the vertebral column, through a passageway called the spinal canal. The spinal canal is formed by the openings that run vertically through the middle of adjoining vertebrae. The cord terminates at the level of the second lumbar vertebra, L2. The cord contains nerve cell bodies, but a larger portion is composed of extensions from those bodies that facilitate communication between neurons. Before connecting with the brain, nerve fibers from the spinal cord cross over from one side to the other. This accounts for the fact that many actions taking place on one side of the body are controlled by the cerebral hemisphere on the opposite side. The primary function of the spinal cord is to transmit messages between the brain and the body. These messages are passed along the nerve fibers as electrical impulses, moving quickly from one nerve to the next. The peripheral nervous system. The peripheral nervous system is divided into the somatic nervous system and the autonomic nervous system. The autonomic nervous system, in turn, is divided between the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is responsible for the fight or flight reaction that enables us to respond under stress. This reaction generally increases activity within the body. When stimulated, the sympathetic nervous system increases blood flow to the skeletal muscles, increases heart and respiratory rates, dilates the pupils, increases production and use of energy, dilates respiratory passageways, and causes sweating. By contrast, the parasympathetic nervous system tends to slow the body's activities or return the body to its resting state. Effects include pupil constriction, promotion of digestive system activities, constriction of airway passages, and reduction of heart rate and force of contraction. There are two types of nerves used in the peripheral nervous system: sensory nerves and motor nerves. Sensory nerves. Sensory nerves are complex. They can be found in the eyes, ears, skin, muscles, joints, lungs, and other organs. When a sensory cell is stimulated, it transmits a message to the brain. There are many different kinds of sensory nerves. Some detect heat or cold, while others relay information about position, motion, pressure, pain, balance, light, taste, smell, or some other sensation. Every sensory nerve uses specialized nerve endings unique to its type, so that it perceives and communicates information about a single type of sensation. Most sensory nerves must carry information to the brain via the spinal cord. Others take information to the brain directly, without having to go through the spinal cord first. One example of a nerve with a direct line of communication with the brain that bypasses the spinal cord is the optic nerve. Its nerve endings are found in the retina of the eye. When stimulated by light, the optic nerve carries visual information from the eye straight to the occipital lobe of the brain, where it is interpreted. It does not pass through the spinal cord. By contrast, when sensory nerve endings in the extremities are stimulated, they transmit the impulses along a peripheral nerve to the spinal cord. The information is then conducted up the spinal cord, passing from one neuron to the next, until it reaches the parietal lobe of the cerebrum. In many cases, sensory information cannot be acted on until the brain has received and decoded the message sent by the sensory nerves. The brain must then reply with a command, telling the body how to respond. In other cases, certain stimuli can evoke a physical response even before the message reaches the brain. In such instances, the impulse is intercepted by a nearby motor nerve, which promptly initiates physical movement. For example, imagine accidentally placing your hand on a hot stove. Technically, you will withdraw your hand before you feel the heat. Such withdrawal reflexes exist to limit damage to the body. Motor nerves. Every skeletal muscle in the body has its own motor nerve. Whereas sensory nerves carry information to the brain, motor nerves carry information from the brain to the muscles. Motor neuron cell bodies reside in the spinal cord. From these cell bodies, axons extend to skeletal muscles. When an electrical impulse is generated by the cerebral cortex, it travels down the nerve to the muscle that neuron controls. In response, the muscle contracts. The integumentary system, skin. Anatomy. The cutaneous membrane, or skin, is the largest single organ in the body. It has two major components, the epidermis and the dermis. Beneath these layers is subcutaneous tissue. The outermost layers that make up the skin's surface are known collectively as the epidermis. Epi is a prefix meaning above. The epidermis forms a watertight barrier that provides considerable protection, keeping microorganisms from getting inside the body while preventing fluid from escaping. Its thickness varies depending on its location on the body. On the soles of the feet, and the palms of the hands, the back, and the scalp, the skin is quite thick, while in other areas it is only 2 or 3 cells thick. Epidermal cells are arranged in multiple layers. The innermost layer, called the germinal layer, continuously produces new cells that gradually ascend through the other skin layers. The germinal layer also contains cells that produce pigment granules, which give the skin its color. In time, germinal layers reach the exposed surface layer, called the stratum corneum. Whereas the germinal layer is supplied with blood, the stratum corneum is not. Thus, the cells of the corneum are dead and are continually shed and replaced by new cells arriving from the layers below. The journey from the germinal layer to the surface takes about 4 weeks. Located beneath the epidermis, the dermis is home to the sweat glands, sebaceous, oil glands, hair follicles, blood vessels, and nerve endings. Sweat reaches the surface of the skin by way of small pores, or ducts, that pass from sweat glands in the dermis, and up through the epidermis. Sweat helps to cool the body. Hair follicles are small organs that produce hair. As hair grows, it passes along a shaft, ultimately reaching and emerging from the epidermal surface. Connected to the hair is a small muscle that pulls the hair into an erect position when triggered by certain stimuli, for example, cold air or fright. Hairs grow and are shed according to a hair growth cycle. Adjacent to hair follicles, sebaceous glands secrete an oily substance called sebum along the hair follicles to the skin surface. Sebum seals the surface, waterproofing the skin, and preventing it from drying and cracking. Blood vessels provide nutrients and oxygen to the skin. The blood vessels lie in the dermis. Small branches extend up to the germinal layer. A complex array of nerve endings also lies in the dermis. These specialized nerve endings are sensitive to environmental stimuli. They respond to these stimuli and send impulses along the nerves to the brain. Beneath the skin, immediately under the dermis, and attached to it, lies the subcutaneous tissue. The subcutaneous tissue is composed largely of fat, which serves as an insulator for the body, and a reservoir that stores energy. The amount of subcutaneous tissue varies greatly from individual to individual. The subcutaneous layer helps to anchor the skin to the structures below, for example, the muscles and skeleton. As you age, the loss of subcutaneous tissue causes a reduction in support for the skin, resulting in wrinkles. While skin covers the entire external surface of the body, it does not cover the various openings to the body such as the mouth, nose, anus, and vagina. Instead, these structures are lined with mucous membranes. Mucous membranes are quite similar to skin in that they provide a protective barrier against bacterial invasion. However, they differ from skin in that they secrete mucus, a watery substance that lubricates and keeps them moist. A continuous mucous membrane lines the entire length of the gastrointestinal tract, from mouth to anus. The integumentary system, skin. Physiology. The skin serves multiple functions. Chief among these are 2. 1. Protect the body from the environment, 2. Maintain normal body temperature, and 3. Transmits sensory information, that is, touch, pain, pressure, and temperature, from the environment to the brain. The protective functions of the skin are numerous. Water makes up a large portion of the body. This water contains a delicate balance of chemical substances in solution. The skin is watertight, and serves to keep this balanced internal solution intact. The skin also protects the body from the invasion of infectious organisms, bacteria, viruses, and fungi. These organisms are everywhere and are routinely found lying on the skin surface. However, they typically do not penetrate the skin unless it is broken by injury. Thus, the skin provides a constant protection against outside invaders. The major organ for regulation of body temperature is the skin. Blood vessels in the skin constrict when the body is in a cold environment, and dilate when the body is in a warm environment. In a cold environment, constriction of the blood vessels shunts the blood away from the skin to decrease the amount of heat radiated from the body surface. When the outside environment is hot, the vessels in the skin dilate, bringing blood closer to the surface. The skin becomes flushed, red, and heat radiates from the body surface. Also, in a hot environment, sweat is secreted to the skin surface from the sweat glands. Evaporation of the sweat causes the body temperature to fall because water absorbs heat as it evaporates. Sweating alone is not as effective in reducing body temperature. Evaporation of the sweat must also occur. Information from the environment is carried to the brain through a rich supply of sensory nerves that originate in the skin. Nerve endings that lie in the skin are adapted to perceive and transmit information about heat, cold, external pressure, pain, and the position of the body in space. The skin thus recognizes any changes in the environment. The skin also reacts to pressure, pain, and pleasurable stimuli. The digestive system. Anatomy. The digestive system, also called the gastrointestinal system, is composed of the gastrointestinal tract, stomach and intestines, mouth, salivary glands, pharynx, esophagus, liver, gallbladder, pancreas, rectum, and anus. The function of this system is digestion, the processing of food that nourishes the individual cells of the body. Most of the organs of this system are found within the abdomen. The abdomen. The abdomen is the second major body cavity. It contains the major organs of digestion and excretion. The diaphragm separates the thorax from the abdominal cavity. Anteriorly and posteriorly, thick muscular abdominal walls create the boundaries of this space. Inferiorly, the abdomen is separated from the pelvis by an imaginary plane that extends from the pubic symphysis through the sacrum. Some organs lie in the abdomen and the pelvis, depending on the posture of the patient. The simplest and most common method of describing the portions of the abdomen is by quadrants, the four equal areas formed by two imaginary lines that intersect at right angles at the umbilicus. On the anterior abdominal wall, the quadrants thus formed are the right upper, right lower, left upper, and left lower. Pain or injury in a given quadrant usually arises from or involves the organs that lie in that quadrant. This simple means of designation will allow you to identify injured or diseased organs that require emergency attention. Organs and vascular structures. In the right upper quadrant, the major organs are the liver, the gallbladder, and a portion of the colon. Most of the liver lies in this quadrant, almost entirely under the protection of the 8th to 12th ribs. The liver fills the entire anteroposterior depth of the abdomen in this quadrant. Therefore, the liver is at risk for injuries in this area. In the left upper quadrant, the major organs are the stomach, the spleen, and a portion of the colon. The spleen is almost entirely under the protection of the left rib cage, whereas the stomach may sag well down into the left lower quadrant when full. The spleen lies in the lateral and posterior portion of this quadrant, under the diaphragm, and immediately in front of the 9th to 11th ribs. The spleen is frequently injured, especially when these ribs are fractured. The right lower quadrant contains two portions of the large intestine, the cecum, the first portion into which the small intestine, ileum, opens, and the ascending colon. The appendix is a small, tubular structure that is attached to the lower border of the cecum. In the left lower quadrant lie the descending and the sigmoid portions of the colon. Several organs lie in more than one quadrant. The small intestine, for instance, occupies the central part of the abdomen around the umbilicus, and parts of it lie in all four quadrants. The pancreas lies just behind the abdominal cavity on the posterior abdominal wall in both upper quadrants. The large intestine also traverses the abdomen, beginning in the right lower quadrant and ending in the left lower quadrant as it passes through all four quadrants. The urinary bladder lies just behind the pubic symphysis in the middle of the abdomen and, therefore, lies in both lower quadrants, and also in the pelvis. The kidneys and pancreas are called retroperitoneal organs because they lie behind the abdominal cavity. They are above the level of the umbilicus, extending from the 11th rib to the 3rd lumbar vertebra on each side. The kidneys are approximately 5 inches, 13 cm, long and lie just anterior to the crustovertebral angle, which is the junction between the posterior aspect of the lower portion of the rib cage and the spine. Mouth. The mouth consists of the lips, cheeks, gums, teeth, and tongue. A mucous membrane lines the mouth. The roof of the mouth is formed by the hard and soft palates. The hard palate is a bony plate lying anteriorly, the soft palate is a fold of mucous membrane and muscle that extends posteriorly from the hard palate into the throat. The soft palate is designed to hold food that is being chewed within the mouth, and to help initiate swallowing. Salivary glands. There are 2 sets of salivary glands, one set on each side of the mouth under the tongue, and the other set in front of each ear. They produce nearly 1.5 liters of saliva daily. Saliva is approximately 98% water. The remaining 2% is composed of mucus, salts, and organic compounds. Saliva serves as a binder for the chewed food that is being swallowed, and as a lubricant within the mouth. Saliva also contains certain digestive enzymes. Oropharynx. The oropharynx is a tubular structure that extends vertically from the back of the mouth to the esophagus and trachea. An automatic movement of the pharynx during swallowing lifts the larynx to permit the epiglottis to close over it so that liquids and solids are moved into the esophagus, and away from the trachea. Esophagus. The esophagus is a collapsible tube about 10 inches, 25 cm, long that extends from the end of the pharynx to the stomach, and lies just anterior to the spinal column in the chest. Contractions of the muscle in the wall of the esophagus propel food through it to the stomach. Liquids pass with very little assistance. Stomach. The stomach is a hollow organ located in the left upper quadrant of the abdominal cavity, largely protected by the lower left ribs. Muscular contractions in the wall of the stomach, and gastric juice, which contains a lot of mucus, convert ingested food to a thoroughly mixed semi-solid mass, called chyme. The stomach produces approximately 1.5 liter of gastric juice daily for this process. The primary function of the stomach is to receive food in large quantities intermittently, store it, and provide for its movement into the small bowel in regular, small amounts. In 1 to 3 hours, the semi-solid food mass derived from one meal is propelled by muscular contraction into the duodenum, the first part of the small intestine. Pancreas. The pancreas, a flat, solid organ, lies below and behind the liver and stomach and behind the peritoneum. It is firmly fixed in position, deep within the abdomen, and is not easily damaged. It contains 2 kinds of glands, and the 2 portions of the pancreas are intertwined. One portion is exocrine, and it secretes nearly 2 liters of pancreatic juice daily. This juice contains many enzymes that aid in the digestion of fat, starch, and protein. Pancreatic juice flows directly into the duodenum through the pancreatic ducts. The other portion of the gland, the islets of Langerhans, is endocrine. These islets are where insulin and glucagon, hormones, are produced. Insulin and glucagon regulate the amount of glucose in the blood. Liver. The liver is a large, solid organ that takes up most of the area immediately beneath the diaphragm in the right upper quadrant, and also extends into the left upper quadrant. It is the largest solid organ in the abdomen, and has several functions. poisonous substances produced by digestion are brought to the liver, and rendered harmless. Factors that are necessary for blood clotting, and for the production of normal plasma are formed here. Between 0.5 and 1 liter of bile is made by the liver daily to assist in the normal digestion of fat. The liver is the primary organ for the storage of sugar or starch for immediate use by the body for energy. It also produces many of the factors that aid in the proper regulation of immune responses. The liver is fragile and, because of its size, relatively easily injured. Blood flow in the liver is high, because all of the blood that is pumped to the gastrointestinal tract passes into the liver, through the portal vein, before it returns to the heart. In addition, the liver has a generous arterial blood supply of its own. Ordinarily, approximately 25% of the cardiac output of blood, 1.5 liter, passes through the liver each minute. Bile ducts. The liver connects with the intestine by way of the bile ducts. The gallbladder is a small pouch extending from the bile ducts that serves as a reservoir and concentrating organ for bile produced in the liver. Together, the bile ducts and the gallbladder form the biliary system. The gallbladder discharges stored and concentrated bile into the duodenum through the common bile duct. The presence of food in the duodenum triggers a contraction of the gallbladder to empty it. The gallbladder usually contains about 60 to 90 milliliters of bile. Small intestine. The small intestine is the major hollow organ of the abdomen. The cells lining the small intestine produce enzymes and mucus to aid in digestion. Enzymes from the pancreas and the small intestine carry out the final processes of digestion. More than 90% of the products of digestion, amino acids, fatty acids, and simple sugars, together with water, ingested vitamins, and minerals, are absorbed across the wall of the lower end of the small intestine into veins to be transported to the liver. The small intestine is composed of the duodenum, the jejunum, and the ileum. The duodenum, which is about 12 inches, 30 centimeter, long, is the part of the small intestine that receives food from the stomach. Here, food is mixed with secretions from the pancreas and liver for further digestion. Bile, produced by the liver, and stored in the gallbladder, is emptied as needed into the duodenum. Bile is green-black, but through changes during digestion, it gives feces its typical brown color. Its major function is in the digestion of fat. The jejunum and ileum together measure more than 20 feet, 6 meters, on average to make up the rest of the small intestine. Large intestine. The large intestine, another major hollow organ, consists of the cecum, the colon, and the rectum. About 5 feet, 1.5 meters, long, it encircles the outer border of the abdomen around the small bowel. The major function of the colon, the portion of the large intestine that extends from the cecum to the rectum, is to absorb the final 5% to 10% of digested food and water from the intestine to form solid stool, which is stored in the rectum, and passed out of the body through the anus. Appendix. Recall that the appendix is a tube that opens into the cecum, the first part of the large intestine, in the right lower quadrant of the abdomen. It is 3 to 4 inches, 8 to 10 centimeter, long and may easily become obstructed and, as a result, inflamed and infected. Appendicitis, which is the term for this inflammation, is one of the major causes of severe abdominal distress. Rectum. The lowermost end of the colon is the rectum. It is a large, hollow organ that is adapted to store quantities of feces until it is expelled. At its terminal end is the anus, a 2-inch, 5 centimeter, canal lined with skin. The rectum and anus are supplied with a complex series of circular muscles, called sphincters, that control, voluntarily and automatically, the escape of liquids, gases, and solids from the digestive tract. Table 6-11 provides a summary of the organs and functions of the digestive system. The digestive system. Physiology. Digestion of food, from the moment it is taken into the mouth until essential compounds are extracted and delivered by the circulatory system to nourish all cells in the body, is a complicated chemical process. In succession, different secretions, primarily enzymes, are added to the food by the salivary glands, the stomach, the liver, the pancreas, and the small intestine to convert the food into basic sugars, fatty acids, and amino acids. These basic products of digestion are carried across the wall of the intestine, and transported through the portal vein to the liver. In the liver, the products are processed further and stored or transported to the heart through veins draining the liver. The heart then pumps the blood with these nutrients throughout the arteries to the capillaries, where the nutrients pass through the capillary walls to nourish the body's individual cells. In normal routine activity, without any food or fluid ingestion at all, between 8 and 10 liters of fluid is secreted daily into the gastrointestinal tract. This fluid comes from the salivary glands, stomach, liver, pancreas, and small intestine. In a healthy adult, about 7% of the body weight is delivered as fluid daily to the gastrointestinal tract. If significant vomiting or diarrhea occurs for more than 2 or 3 days, the person will experience a substantial alteration of body composition and become severely ill. The lymphatic system. Anatomy and physiology. The lymphatic system includes the spleen, lymph nodes, lymph vessels, thymus gland, and other components. It supports both the circulatory system and the immune system. Unlike the circulatory system, the lymphatic system has no pump, and relies on muscle contractions and movements of the body for lymph to flow. Lymph is a thin, straw-colored fluid that carries oxygen, nutrients, and hormones to the cells and waste products of metabolism away from the cells, and back into the capillaries so that they may be excreted. Lymph vessels closely parallel the veins, forming a network throughout the body that serves as an auxiliary to the circulatory system. Lymph nodes are located in various places along the lymph vessels in the body. These tiny, oval-shaped structures filter lymph. Together with the circulatory system, the lymphatic system helps to rid the body of toxins and other harmful materials. The spleen also plays an important role in the body's immune function. It houses immune cells that help eliminate infectious agents. The endocrine system. Anatomy and physiology. The brain controls the body through the nervous system using electrical impulses, and the endocrine system using hormones. The endocrine system is a complex message and control system that integrates many body functions. Endocrine glands release their hormones directly into the bloodstream. Epinephrine, norepinephrine, and insulin are examples of hormones. Each endocrine gland produces one or more hormones. Each hormone has a specific effect on some organ, tissue, or process. The brain controls the release of hormones by the endocrine glands. Hormones can have a stimulating or an inhibiting effect on the body's organs and systems. For example, when you are frightened, your brain stimulates the adrenal gland through a hormone to release epinephrine and norepinephrine. This increases your blood pressure and heart rate. The resulting increase in blood pressure and heart rate decreases the amount of hormone released by the adrenal gland. The brain then reduces the amount of stimulation to the adrenal glands. Thus, a new steady state is achieved at heightened levels of alertness. This cycle is known as a feedback loop, and it helps keep the body's systems and functions in balance. Excesses or deficiencies in hormone levels cause various diseases. With endocrine diseases, specific body functions are increased, decreased, or absent. Type 1 diabetes mellitus is a common endocrine condition. Because production of the hormone insulin is deficient, the body is unable to use glucose normally. Glucose is the primary fuel of the body. Insulin is responsible for rapidly moving glucose into cells. Without insulin, glucose moves slowly. This creates a series of complications as the body struggles to find a more readily available fuel for its cells. People with diabetes begin to burn fats and proteins to create the glucose that cells require. Interestingly, the end result is higher and higher blood glucose levels as glucose accumulates, unable to be efficiently moved into the cells. Chapter 20, Endocrine and Hematologic Emergencies, discusses how high blood glucose levels affect the body. The urinary system. Anatomy and physiology. The urinary system controls the discharge of certain waste materials filtered from the blood by the kidneys. In the urinary system, The kidneys are solid organs, the ureters, bladder, and urethra are hollow organs. The main functions of the urinary system are 1. To control fluid balance in the body, 2. To filter and eliminate wastes, and 3. To control potential hydrogen balance. The body has 2 kidneys that lie on the posterior muscular wall of the abdomen behind the peritoneum in the retroperitoneal space. These organs rid the blood of toxic waste products and control its balance of water and salts. Blood flow in the kidneys is high. Nearly 20% of the output of blood from the heart passes through the kidneys each minute. Large vessels attach the kidneys directly to the aorta and the inferior vena cava. Waste products and water are constantly filtered from the blood to form urine. The kidneys continuously concentrate this filtered urine by reabsorbing the water as it passes through a system of specialized tubes within them. The tubes finally unite to form the renal pelvis, a cone-shaped area within the kidney that collects urine and funnels it through the ureter into the bladder. Normally, each kidney drains its urine into one ureter through which the urine passes to the bladder. A ureter passes from the renal pelvis of each kidney along the surface of the posterior abdominal wall behind the peritoneum to drain into the urinary bladder. The ureters are small, 0.2 inch, 0.5 centimeter, in diameter, hollow, muscular tubes. Peristalsis, a wave-like contraction of smooth muscle, occurs in these tubes to move the urine to the bladder. The urinary bladder is located immediately behind the pubic symphysis in the pelvic cavity, and is composed of smooth muscle with a specialized lining membrane. The 2 ureters enter posteriorly at its base on either side. The bladder empties to the outside of the body through the urethra. In a man, the urethra passes from the anterior base of the bladder through the penis. In a woman, the urethra opens in front of the vagina. A healthy adult forms 1.5 to 2 liters of urine every day. This waste is extracted and concentrated from the 1,500 liters of blood that circulates through the kidneys daily. The genital system. Anatomy and physiology. The genital system controls the reproductive processes. The male genitalia, except for the prostate gland and the seminal vesicles, lie outside the pelvic cavity. The female genitalia, with the exception of the clitoris and labia, are contained entirely within the pelvis. The male and female reproductive organs have certain similarities and, of course, basic differences. They produce sperm and egg cells and reproductive hormones, and play a significant role in sexual intercourse and reproduction. The male reproductive system and organs. The male reproductive system consists of the testicles, epididymis, vasa deferentia, prostate gland, seminal vesicles, and penis. Each testicle contains specialized cells and ducts. Some of these produce male hormones, and others develop sperm. The hormones are absorbed directly into the bloodstream from the testicles. The sperm are immature and are moved from the testicles to the epididymis so they can develop. The sperm are carried through vasa deferentia, or vas deferens, to the seminal vesicles, where they are stored. During ejaculation, they are passed through the urethra. The function of the reproductive system is to reproduce. Sperm are able to join with an egg to form an embryo. In addition to reproduction, this system is responsible for the production of sex hormones. Many of the physical characteristics of men, such as increased muscle mass, body hair, and deep voice, are attributed to the powerful effects of the hormones released by the testes. Finally, the penis, though part of the reproductive system, is also part of the urinary system. Any damage or infection to the penis can cause problems within the urinary bladder and/or the kidneys. The female reproductive system and organs. The female reproductive organs include the ovaries, fallopian tubes, uterus, cervix, and vagina. The ovaries, like the testicles, produce sex hormones and specialized cells for reproduction. The female sex hormones are absorbed directly into the bloodstream. A specialized ovum, or egg cell, matures and is released regularly during the adult woman's reproductive years. The ovaries release a mature egg approximately every 28 days. This egg travels through the fallopian tubes, where fertilization normally occurs. The fallopian tubes exit into the uterus. The fallopian tubes, sometimes called uterine tubes, connect with the uterus, and carry the ovum into the cavity of this organ. The uterus is pear-shaped and hollow, with muscular walls. The narrow opening from the uterus to the vagina is the cervix. The vagina, birth canal, is a muscular, distensible tube that connects the uterus with the vulva, the external female genitalia. The vagina receives the penis during sexual intercourse, when semen is deposited in it. The sperm in the semen may pass through the uterus, and fertilize an egg, typically in the fallopian tube, resulting in pregnancy. Should the pregnancy come to completion at about 40 weeks, the neonate will pass through the vagina, and be born. The vagina also channels the menstrual flow from the uterus out of the body. The functions of the female reproductive system are similar to those of the male reproductive system: reproduction and hormone balance. Life support chain. To perform their job, the body's cells, tissues, and organs, regardless of their function, all depend on the reliable supply of oxygen and nutrients and the removal of wastes. Oxygen is brought to the cells via the respiratory and circulatory systems. Nutrients are derived from the food we eat after the digestive system breaks it down into, among other things, glucose. The circulatory system then delivers these supplies while picking up and carrying away waste through the process of perfusion. If interference occurs in this delivery system, cells will become damaged or die. Cells use oxygen to turn available nutrients into chemical energy through the biochemical process of metabolism. Adenosine triphosphate is used in energy metabolism and storage. Cells prefer to use oxygen for this process, referred to as aerobic metabolism, meaning with air, as doing so provides the cells with 15 times more adenosine triphosphate than is possible without oxygen. The waste products of aerobic metabolism are carbon dioxide and water. In the absence of oxygen, most cells turn to a faster yet less efficient means of producing adenosine triphosphate called anaerobic metabolism, without air. The most well-known byproduct of anaerobic metabolism is lactic acid, which is the material that causes muscle burning during anaerobic activities like weightlifting. Most cells can tolerate anaerobic metabolism for only about 1 to 3 minutes, and some specialized cells, such as the heart and brain, are unable to survive without a constant supply of oxygen. Brain cells, for example, begin to die after only 4 to 6 minutes without oxygen. As lactic acid and other wastes accumulate around the cells, the area becomes toxic. Cells subjected to this toxic waste may die. Given enough time, and a large enough number of affected cells, whole organs may fail, and the individual may go into cardiac arrest. The main force enabling all of this movement of material, oxygen, waste, nutrients, is diffusion. Recall that when you breathe, oxygen moves from an area of higher concentration to one of lower concentration. Cells are surrounded by fluid that allows for easy movement of nutrients and wastes. A physical property of this fluid that is a critical factor for cell survival is potential hydrogen, which is the measure of acidity or alkalinity in a solution. Solutions that are high in potential hydrogen, greater than 7.0, are considered alkaline. A common example is soap. Solutions that are low in potential hydrogen, less than 7.0, are considered acidic. Sulfuric acid in automotive batteries is one example. A solution that is neither acidic nor alkaline is considered neutral, potential hydrogen 7.0. The body's cells want to exist in a near-neutral environment. Your body spends a large amount of energy working to maintain a normal potential hydrogen. Normal human potential hydrogen is 7.35 to 7.45. The waste products of cells are often acidic, such as carbon dioxide. Carbon dioxide is transported by combining with water to create carbonic acid, which is more soluble in the plasma. The plasma also contains sodium bicarbonate, which is alkaline and helps to buffer or neutralize the acidic waste products of cells. The blood and lungs interact continuously to help to maintain the potential hydrogen level in the body by controlling the level of carbon dioxide, and therefore the level of carbonic acid, in the blood. If the blood becomes acidic, the respiratory centers in the brainstem will increase breathing to blow off more carbon dioxide. If too much carbon dioxide is blown off, then the body can become too alkaline, which is what happens during hyperventilation. Pathophysiology. As mentioned previously, pathophysiology is the study of how normal physiologic processes are affected by disease. Many diseases can occur in patients, and will result in calls to emergency medical service. Some examples are diabetes, a disease of the pancreas, pneumonia, a disease of the lungs, and stroke, resulting from disease of the brain. Pathophysiologic changes that occur with specific diseases and trauma, respectively, are discussed in the chapters of Section 6, Medical, and Section 7, Trauma. Respiratory compromise and shock are two common emergencies that you will likely encounter in your work as an emergency medical technician. This section provides an overview of respiratory compromise, shock, and alteration of cell metabolism as background for how the body responds to disease or injury. Respiratory compromise. Respiratory compromise is the inability of the body to move gas effectively, which can result in a decreased level of oxygen in the body, hypoxia, an elevated level of carbon dioxide in the body, hypercapnia, or both. Recall the two concepts of breathing, ventilation and respiration. Ventilation is the movement of air between the lungs and environment, change while to whereas respiration is the process of gas exchange. Respiratory compromise results when one of these functions is impaired. Factors that impair ventilation. The ability to move gas back and forth can be impaired in a variety of ways. A blocked airway is one example. If a person chokes on what he or she is eating, this will partially or completely block the movement of air through the trachea. The airway can also be blocked by foreign bodies, for example, toys, broken teeth, swelling in the airway, trauma to the mouth or neck, and swallowing blood or vomitus. The most common airway obstruction is blockage by the tongue. When a person is unconscious, the tongue relaxes and sags posteriorly in the mouth. The patient cannot swallow his tongue, but the relaxed tongue may block the opening to the trachea. Fortunately, the airway can be easily opened with manual techniques. This will be discussed in later chapters. Impairment of the muscles of breathing will impair the movement of gas into and out of the lungs. Neuromuscular diseases, such as cerebral palsy, can interfere with the ability of the brain to send signals to the diaphragm. Trauma can injure the phrenic nerve, the nerve that signals the diaphragm to contract and initiate inspiration, or damage the brainstem. If a patient's level of consciousness is too low, ventilatory problems can occur. This means that any condition that results in a loss of consciousness can have a direct effect on ventilation. For example, a soccer player who is unconscious after being struck in the head during a match may have impaired ventilation. Ventilation can also be impaired when the lower airway is obstructed physiologically, for example, during an asthma attack. Early in an asthma attack, hyperventilation results in a decrease in the amount of carbon dioxide in the blood. As the patient fatigues, the level of carbon dioxide increases. Contraction of muscles surrounding the lower airways prevents effective ventilation. Ventilation can also be impaired by numerous other factors, including drug overdose, which depresses the central nervous system, trauma to the chest wall, and allergic reactions. These are discussed in their respective chapters in greater detail. Factors that impair respiration. Impairment of respiration, movement of gas at the cellular level, can also cause respiratory compromise. A change in the atmosphere can interfere with a person's ability to breathe. The air you breathe is 21% oxygen, and the air you exhale is 16% oxygen. This means there is only a 5% margin of safety for oxygen concentration in the air you breathe. In certain situations, for example, in a fire, oxygen is displaced by another gas. When there is insufficient oxygen in the air, insufficient oxygen is inhaled. That means there is less oxygen in the alveoli to diffuse into the blood that passes by the lungs. If the cells of the body do not have enough oxygen delivered to them, they will not be able to function normally. Respiration can also be impaired at high altitudes. At high altitudes, gas pressures change. The low atmospheric pressure of oxygen at high altitudes can impair oxygen movement into the blood. Respiration can also become compromised when movement of the gas across the cell membrane is impaired. If the patient has fluid in the alveoli, this fluid may prevent or hinder gas exchange. In pneumonia, mucus and pus form a barrier, preventing gas from accessing the alveoli. If the interstitial space between the cells in the lungs, is filled with fluid, this edema increases the distance from the capillary to the air in the alveoli. Because of the increased distance, it will take longer for the gas to move from inside the alveoli to inside the capillary. If one of the blood vessels bringing blood to the lungs is clogged, this will also affect the amount of gas that diffuses into and out of the blood. Ventilation or perfusion mismatch. One way to describe respiratory function, and therefore to understand respiratory compromise, is the ventilation or perfusion ratio. This measurement, also called the V or Q ratio, describes how much gas is being moved effectively, ventilation, through the lungs, and how much blood is flowing around the alveoli where gas exchange, perfusion, occurs. A mismatch occurs when one of those two variables is abnormal. For example, in a patient with pulmonary embolism, a blood clot breaks off from a large vein, and creates a sudden clog in one of the branches of the pulmonary arteries, preventing blood flow to the alveoli in the lung. A ventilated segment of the lung does not receive blood, and therefore gas is not exchanged. This results in a ventilation or perfusion mismatch, expressed as a change in the V or Q ratio. Another example is edema caused by pulmonary contusion, in which gas is unable to move effectively through the alveoli in a portion of the lung. Due to fluid bruising in a portion of the lung, blood passing through that portion does not undergo air exchange because there is no ventilation occurring in that portion of the lung. Therefore the V portion of the V or Q ratio is impacted. When either the V or the Q is impacted, respiratory compromise can occur. Effects of respiratory compromise on the body. Regardless of the cause of impaired ventilation or respiration, the overall effect of respiratory compromise is the same. Oxygen levels throughout the body fall and carbon dioxide levels rise. The brain detects an increase in carbon dioxide levels. The body increases its respiratory rate to return the carbon dioxide levels to normal. If increased respiration does not occur or is not effective in returning the carbon dioxide levels to normal, the blood will become more acidic. Similarly, blood oxygen levels will begin to fall. This will cause the brain to issue further commands to breathe. Decreased oxygen levels will force cells to move from aerobic metabolism to anaerobic metabolism. Remember, heart and brain cells cannot survive without a constant supply of oxygen, and will die in minutes. Anaerobic metabolism generates a fraction of the needed energy, and cellular functions will be impaired. Recall that a byproduct of anaerobic metabolism is lactic acid. If too much of this acid is created, the potential hydrogen of the blood will drop further. If the potential hydrogen becomes too low, cells will die. If respiratory compromise is mild and gradual, the body can adapt. Complete anaerobic metabolism that is severe, that is, a complete lack of oxygen in the body, and that lasts more than 1 to 3 minutes, can overwhelm the body's ability to adapt. If left untreated, it can exhaust the body's energy supplies, and the patient may die. Shock. Recall that shock, systemic hypoperfusion, is a condition in which organs and tissues receive an inadequate supply of blood and oxygen. In other words, they are poorly perfused. It can occur due to inadequacy of the central circulation, insufficient blood volume, or a heart that does not pump effectively, or of the peripheral circulation, inability of the body to control the size of the blood vessels. Oxygen delivery is directly related to the concentration of red blood cells, and their hemoglobin concentration, the amount of oxygen being carried by the blood, oxygen saturation, and the pumping ability of the heart, cardiac output. Impairment in any one of these three areas will lead to impaired oxygen delivery and shock. Impaired oxygen delivery causes cellular hypoxia, decreased amount of oxygen delivered to the cells, which leads to anaerobic metabolism, lactic acid production, and organ dysfunction. Shock is categorized into several types depending on the cause. These types are defined in Table 6-14. They are discussed in more detail in Chapter 13, Shock. Effects of shock on the body. The effects of inadequate perfusion on the body are similar to those of respiratory compromise. The level of oxygen supplied to the tissues falls. This causes the cells to engage in anaerobic metabolism, which results in increased lactic acid production. A severe metabolic acidosis ensues, leading to increased levels of carbonic acid within the blood. Patients who can compensate increase their breathing rate and depth, thereby increasing their minute volume. Baroreceptors detect the decreased blood pressure, and initiate the release of epinephrine and norepinephrine. The heart rate will increase, the heart will beat more forcefully, and the blood vessels will constrict. The body's goal is to maintain blood pressure to the areas of the body that are unable to survive without oxygen, the brain and the heart. Another compensatory mechanism, particularly with hypovolemic shock, is the movement of fluid outside of the cells, and outside of the blood vessels, interstitial fluid, into the capillaries. This helps refill the blood vessels, and restore some fluid volume so the heart has enough liquid to pump. However, in other forms of shock such as septic and anaphylactic shock, the capillaries leak and volume from the blood vessels, intravascular volume, moves into the interstitial space. This loss of vascular fluid means there is less blood returning to the heart to pump. Ultimately, the effect of all types of shock is decreased availability of fuel for the cells and impairment of cellular metabolism. Once a certain level of tissue hypoperfusion is reached, cell damage proceeds in a similar manner regardless of the underlying cause of the shock. Alteration of cellular metabolism. Impairment of cellular metabolism results in the inability to properly use oxygen and glucose at the cellular level. As discussed, when there is inadequate oxygen, cells will create energy through anaerobic metabolism. Anaerobic metabolism serves as a temporary backup system to allow cells to function at low energy levels for a short time. Most cells are able to use alternative fuel supplies to help bridge the gap until perfusion is restored. For example, when a person is engaged in strenuous exercise, the demand for glucose by the muscles exceeds the available supply. The body begins to burn fats, and turns them into glucose to meet this need. However, anaerobic metabolism has some important drawbacks. Recall that the use of fats as an alternative fuel supply results in a buildup of lactic acid. This ultimately can result in metabolic acidosis. The process of anaerobic metabolism requires more energy than when using glucose for fuel. Therefore, there are more wastes to be removed, and the body must work harder. Other conditions resulting from anaerobic metabolism include decreased ability of the blood to effectively carry oxygen to the cells, and overall decreased functioning of oxygen within the cell. Although most cells are able to use alternative fuels, brain cells cannot. They rely on a constant supply of glucose to function. When perfusion is impaired, there is less glucose for cells to use. If the supply of available glucose is dramatically decreased, brain cells will quickly become damaged or die. Cellular injury may, up to a point, be repairable if normal tissue perfusion is restored. When irreversible injury occurs, however, no treatment will help. Cell death is followed by necrosis, a process in which the cell breaks down. The cell membrane becomes abnormally permeable, leading to an influx of electrolytes and fluids. The cell and its components, organelles, swell and are ultimately destroyed, resulting in cell death. Therefore, when perfusion is ineffective, it needs to be restored so that cells can return to a state of aerobic metabolism and life can continue. Many interventions you will perform as an emergency medical technician are aimed at improving conditions that can result in impaired perfusion,